My name is Dr. Raja Juanita. I'm a developmental behavioral pediatrician. Thank you for joining me this afternoon. I'm going to talk about children with developmental difficulties and the challenges during the COVID-19 outbreak. We're just bringing up the slides. Okay. Oops. Right. So developmental behavioral difficulties are estimated to affect 10 to 17% of children under 18, and this translates as 900,000 to 1.35 million Malaysian children. What are the common intellectual and developmental behavioral difficulties? That's intellectual impairment or low IQ, autism spectrum disorder, specific learning disorder, speech and language disorder, and attention deficit hyperactivity disorder. These are all very important to recognize early, as we know that early intervention helps. So early intervention means therapy, specialized teaching methods, support and education. Often parents notice difficulties in these categories. So difficulties walking or slow to walk, slow to talk, slow to learn. And when the child attends school or kindergarten, they may notice, or the teachers may notice difficulties writing and drawing, paying attention, and difficulties in some behavioral problems as well. There are a subset of children who have difficulties in behaviors such as sleeping, eating, and socializing. Let's talk about children who talk late or have difficulties talking. So we call this the most common group, late talkers. You may have heard grannies saying, "Budak biasanya cakap bila 5," and actually they are correct about 50 to 60% of the time. So late talkers make up the biggest group of children who have difficulties talking, 10 to 15% at the age of 2 years of age, particularly boys. In these children, the rest of their developmental skills are normal and their understanding is normal. And 50 to 60% of children actually catch up without intervention by 5 years of age. However, it's very important to look at the other 40% and not miss the other 40%. Okay? The other 40% will be falling into these categories: autism spectrum disorder, language disorder or specific language impairment, and those with global developmental delay. A proportion of children with global developmental delay will go on to have intellectual disability. We'll talk about these one by one. Autism spectrum disorder or ASD, I think most of you have heard about this condition. It is a problem with social communication. Social communication is difficulties with eye contact, interaction, and engagement. And communication as well. So when you are playing with the child or trying to teach the child something, you find that the child might not be looking at you, the child is ignoring you, and the child plays and does their own thing. If the child is verbal, they have difficulty having a conversation or using their words to communicate with people. So they may actually use their words to name something. So if they see a car, they just might say car in a book, or if they see the object, but they might not use the word car to actually request. The other big group of problems children with ASD have is rigid and repetitive behavior. So the child might play toys with a certain way, such as they might line up the toys, they might spin the toys, and they might put it in their mouth. Some children, they have what's called mannerisms. So mannerisms are where they are hand flapping, they may be tiptoe walking, they might be spinning themselves, and they have difficulties in transitioning and experiencing new things. So they might want to do things a certain way and follow certain routines, but they have difficulties with things like changes of new places. They might have difficulties with transitioning to new situations or being introduced to new foods, for example. They may have sensory sensitivities, so they're sensitive to certain noises or sensitive to touch or certain textures, like when they eat. What about children with language disorder or specific language impairment? This affects about 5% of children. Many have problems with pronunciation. They might have unclear speech as well, or BILA. The main problem in this children with this problem is speech and understanding as well. Some children may have difficulties with fine motor skills. So fine motor skills are hand skills. And about 40% of children who have still problems with their speech and language from 5 to 6 years of age, they may have problems with reading and spelling. That's because the same area of the brain which processes language also processes reading and spelling. It is the most common developmental disorder from 5 years, and early diagnosis and intervention is important because we know that therapy can help with speech and clarity or the clearness of talking, and also vocabulary difficulties. Global developmental delay. So this is a condition where there are problems with 2 or more areas of development. So it could be, for example, fine motor skills, so that's the hand skills, and also speech and language. A good number of these children, when they start school, they will have problems with their learning, and a proportion of the children will also go on to have intellectual disability or intellectual impairment. Global developmental delay is the term we use for children up to 5 years of age. In 60 to 80%, we don't know the cause of the global developmental delay, but it may be associated with syndromes such as Down syndrome. Another big category of developmental behavioral difficulties is children with learning difficulties. We call it specific learning disorder. You might have heard of dyslexia before, but actually dyslexia just refers to a subset of learning disorders. So dyslexia is problems reading and spelling. We've renamed it as specific learning disorder because we know that the child might not just have problems with reading and spelling, they may have problems with math, understanding, and memory as well. Affects approximately 5% of children. The child might present with poor attention. They may have a background of speech and language delay. They may have difficulties initially recognizing alphabet and numbers, the sounds of alphabets or phonics. They subsequently demonstrate difficulties with reading, and they may have problems with math as well. They have difficulties memorizing nursery rhymes and knowing about words which rhyme. This is an example of an 8-year-old spelling. This child actually did start to read more fluently at 9.5. So many children, they do and they are able to read. However, they may have subsequent difficulties, associated difficulties, that is with spelling and essay writing. Attention deficit hyperactivity disorder. This is a problem where you have difficulties with attention, hyperactivity, and impulsivity. Attention, the child doesn't seem to pay much attention and has difficulty with sitting for long periods. That's hyperactivity. Especially the younger ones, the preschool ones, hyperactivity might be quite noticeable. The child might be impulsive. I mean, the child is impulsive actually. So impulsive is the child doesn't think before they do things. So they might just run out of the road. They're not aware of danger. In Malaysia, affects about 2 to 3% of children under 18 years of age. Parents during the lockdown might have noticed this. What is the role of the multidisciplinary team and professionals? So the pediatrician makes the diagnosis. There are not so many developmental behavioral pediatricians like me in Malaysia. However, Most of the pediatricians can make the straightforward diagnosis. Speech and language pathologists help with communication and with both talking and understanding. Occupational therapists can help in many areas. They help with fine motor skills, so fine motor skills are hand skills. The cognitive areas which involve things like visual-spatial and visual-motor skills, attention, and motor coordination. Physiotherapists help with gross motor skills. So gross motor skills are big muscle movements and skills, including walking, running, balancing. Psychologists can help with some of the psychometric testing. So psychometric testing is like IQ testing, as well as some of the attention and behavioral testing as well. Audiologists help with hearing assessment. Optometrists help with long-sightedness and short-sightedness. We like to involve teachers because it's very, very important to support the children in the education system. Rarely we need social workers, or not so common to have social workers involved, but certainly a proportion of the children will require the card OKU, or the special needs card, which is allows certain benefits. Now, what about during the COVID-19 period? There have been some challenges, but there are standard operating procedures in place. So, for example, the professionals all wear masks and they disinfect the equipment in between patients. We do not advise masks for children under 2 because it actually can obstruct breathing. Over 2, it's encouraged, but it's not compulsory. What about COVID-19 and children? So the current evidence in children is that they are at lower risk, and this is also from data published by the Ministry of Health in Malaysia. They don't seem to get it as much. They also have milder disease, but we do have to observe this evidence and this data because there are more antibody tests being done, and perhaps we're going to pick up more children who were not symptomatic at all, so they didn't have any symptoms. You need to be aware of the pediatric multi-system inflammatory syndrome. So this has been reported in Europe and the US. It hasn't been reported in China. It affects children, and what happens is it can occur several weeks after the COVID-19 infection. In this condition, the child has a high fever, the child has a rash. Very frequently, they have stomach ache or abdominal pain, and rarely they may actually have swelling of their blood vessels which supply their heart, so their coronary arteries. That's rare. And it's also rare to have intensive care treatment for children with this multi-system inflammatory syndrome. There is a treatment for it. It's called immunoglobulin. As far as I know, in Southeast Asia as well, it hasn't been reported. There are some challenges for children under 7 years and for children with special needs because there is significant difficulties with social distancing at the young age and for children with special needs, and difficulties wearing the mask properly. So there are standard operating procedures in place, special ones for kindergartens and daycare centers where they don't share bedding, they don't share toys or cutlery, and there's frequent disinfection. No visitors are allowed on the premises, and the emphasis is on well-staffed and children, and certainly no unwell staff, even with very mild colds, and certainly no staff who have contacts of persons under investigation. And education, of course, is very important. I have to say that I'm really, really pleased and amazed at children from 3 years of age, how well they've been wearing masks. And you also should educate children not to be close and touch other children as well, and not touch their mask. There has been significant impact of COVID-19 on children with developmental behavioral difficulties. There's been delayed diagnosis and treatment. There's been impact on the child itself, so the child sleeping and their diet upside down. Okay. There's been screen time addiction and tantrums when the screens are not allowed. Some children have developed anxiety about themselves or about their family members getting COVID-19. Some individuals have had improved social skills and communication because they've been in the house with their parents and their family. They've been interacting and communicating with their family, so that's great. And however, adults have found it quite difficult, the ones who have been working at home. There have been a small number of children who have actually regressed. So I've had children who were just toilet trained, but during this period, during the lockdown, they've gone back to wearing nappies because their routine's been all upside down. And there are again a small number of children where I've had to do some crisis management, where I've had to medicate the children because they've developed significant behavioral problems at home. Now, many of the intervention centers, the special needs schools, and the therapists have actually been great, and they've been trying to teach online, but it's been difficult. It's not easy to have a child with special needs in front of the computer for long periods of time. And the children who have gone back to the schools or their centers, they have had difficulty transitioning. They've been so used to doing their own thing at home. There have been a good number who have had difficulty going back. So in summary, do not delay diagnosis even during this period, and don't delay treatment. Children can get COVID-19, but current evidence is they are less susceptible. You do need to continue monitoring the press and the data, and they tend to get it milder. You also need to know about that pediatric multi-system inflammatory syndrome. And I'd like to reassure parents at this time that there are good standard operating procedures for therapy, daycare, kindergarten, and school. Thank you.